Welcome to the W.T.F. Where's the Focus podcast. I'm going to bring you a weekly short message on where you put your focus as it relates to sales and building successful business relationships. Knowing where your focus goes, your energy flows. I'm Dan Manginelli, the author of the books Wake Up, Jumpstart the Life You've Always Had in Mind, and Shake It Up, Big Dreams and Bold Choices on the Road to Success. A national speaker on staying motivated and inspired with the right mindset and coach top salespeople around the nation. So let's get going with WTF. What happened can't push buttons. I got a new person here, Jen. She's running the board. The buttons are all off. I didn't get my ta-da on time. I got a Bosa jersey on. Is this the best? Did you sweat in this too? Holy cow. Did you get it off his back?
Never worn it.
Going with the Charger jersey. Welcome to the WTF. Where's the Focus podcast, episode 10. We made it to 10. What do you think, huh? How about 10? 10 is correct. Thanks for sticking with us as we're finding our way through it. Last week, we had a great interview with top recording artist Marshall Altman. If you don't, or you haven't heard that, go back and listen to that. Please subscribe and help me out. Smash that subscribe button. Hit it hard. It means nothing to you, but a bunch to me. Middle of August, kids are back to school. Whoop, whoop. Tara, ours aren't yet, though, but it's some of them are back to school. Can't wait to, just like you, wake our 9-year-old daughters up as they found this newfound sleeping in thing as things are going on right now. It's going to be great. Can't wait. Boy's off to college next week to start his golf career. When's yours going, E? Is it?
Still got another month.
Got another month before yours goes college?
Month, thankfully. Hey, you guess to spend some time with me?
Oh, I guess spend some time or get him off.
My daughter who spends more money is gone tomorrow, so that's good.
She can't spend any more summer money. Wonderful. 16-year-old now drives to school, doesn't really need me anymore. So there we are in August. Hey, you're in for a treat this week. Get your brain cells ready because it took me a while to, you're too smart is what the problem is. Get your brain cells. We have a very educated guest this week. We're all going to learn a bunch together today, and I'm privileged. I'm going to tell you who it is. She's an accomplished there's so many big words I can't even say. Accomplished biopharmaceutical leader with 20 years commercial experience across pharmaceuticals, medical devices, buy and bill, large global, and she works for a Fortune 500 organization. Told you it's going to be hard here, Tara. She's a distinguished track record launching new products and new campaigns that accelerate growth and extended life cycles, built markets. She currently leads the glaucoma group at Allergan. During her tenure at Allergan, she has led successful launch of 6 products, new products across glaucoma, overactive bladder, spasticity, I don't know if I said that one right, migraines, and cerebral palsy, emphasizing best in class, innovative training on DTC optimization and plant access and support. She's committed to the relentless pursuit of improved patient outcomes and has served on the Urology Care Foundation board and is currently on the American Glaucoma Foundation Advisory Board and has parented closely with the parent advocacy and education groups, including the Estonia Medical Research Foundation, the National Headache Foundation, and the American Migraine Foundation. She's recently awarded the HBA Luminary Award for dedication of being a role model to others. That's awesome. Amplifying leadership and exhibiting dedication to the healthcare and life science industries. She's an undergraduate degree in human biology at Stanford University and an MBA from UCLA Anderson School of Management. Help me welcome Tara Capalbo.
Well, I'm excited to be here, Dan.
We got the cheers there. I didn't even get that. At least she got pushed the right way this time. Right? There she is. There she is. Man, you make this podcast look better. I'll tell you what right now. I think this week's episode should be called Beauty and the Beast, if anything. You look better to me. You're classing up the place. That is an awesome, awesome, awesome bio, by the way. I mean, what excites me about this week, everybody who's listening, is we get to talk to a woman of influence, which is a huge success, and at executive level at a Fortune 500 company. So I want to kind of get right to it. I don't want to kill all your time of the advocacy of the whatever. I don't know. So let's start off, Tara, on asking kind of what we is. So how does someone start if they're going to say, you know what, I'm going to be the general manager and run the glaucoma business at a Fortune 500 company? Where did you start? Where did it all come to fruition?
Yeah, well, let me, I'll tell you a little bit about how I got here. And so I started out, I decided really early on that I wanted to go to Stanford. And the reason, Dan and I have talked about this before, but the reason is, I think I saw some kind of college athletic event and I loved what I saw in terms of the crowds and the excitement. I heard this is a pretty prestigious school. And so I started working pretty hard. And what I found is that, to get in, what I found is that I loved science. So that was my favorite subject in school. I grew up in San Diego. And so I had the opportunity when I was, in high school, I volunteered at Rady's Children's Hospital. And that was when I first got interested in this patient care side of things and being able to, impact patients' lives. And so when I went to college, I majored in human biology and actually focused, I thought I might be pre-med, or I took pre-med classes throughout college. And then when graduating, there was something where I wasn't quite convinced that was the right path, because I said, it could be really fun to work on the business side of science. And so I took a job there at actually a company in marketing analytics and market research, just to get my foot in the door, right? They needed somebody that was going to be a paper pusher, that was going to download stuff from Google and print it out and reports and do all that. And so and make a lot of copies. And so I did all of
bioscience then. I could definitely make copies. I'm good at that. I can't read bios, but I can make copies. That's for sure.
Exactly. So I did that. And was able to, I understood pretty early on that if you wanted to be successful in the commercial organization of a biopharmaceutical company, that you needed to get sales experience too. And so I had the opportunity, we had somebody go out on maternity leave, and they let me kind of move into her role and kind of cover her while she was on maternity leave, which again, it was tough to get a job in sales, right, in a biopharma company. So this is a great opportunity. Wasn't one I necessarily planned for. I just jumped on the opportunity when it happened. And again, got to learn that sales side of thing, which was really important because again, Dan, as you and I have talked about, the sales skills that you learn in any industry are really applicable across being successful with anything you do, right? And so I did that for a little bit, but I enjoyed it, but I recognized what I really loved was the marketing side of things. The reason being is I really loved the thinking about the next 5 years and how are we going to be successful. And that really meant being in meetings where we talked about pipeline and how are we going to come up with new products and what were the unmet patient needs in this space. And so working with the R&D teams, the research and development teams, the clinical teams, the business development team, talking to other companies that had assets that we were thinking about. That's the part that I really enjoyed. So I moved back into marketing after that sales role. And then they asked me to put together a forecast. And remember, I was a human biology major. And so I had no idea how to put together a forecast. And so I went on Google and I said, how to forecast. And that's when I realized I should probably go back and learn, a little bit more professionally on how to do that side of things. So that was when I kind of made the call, instead of going back and getting a medical degree, that I really did want to kind of pursue a career in business and medicine in this industry. And that I went back and got my MBA.
So when you were in sales, did that person get their sales job back after they came on maternity leave, or were you just too good?
They did, and they were way better than me when they came back.
Did you pull the Drew Bledsoe, where you just took their job and Tom Brady just ran with it? Now has 18 different Super Bowl rings. You just said, "Sorry, I'm better than she got her job back."
She got her job back.
So you went back to school after you figured, you know what, I like the business side. Because when you were going the other way, were you focusing more on sales, or did you know that you really, really wanted to be in marketing?
You know what? I've always loved marketing a lot. So I think I knew that I wanted to have that experience, and ultimately knowing that if you want to run a company, run a commercial organization, sales are what keeps the lights there. I mean, you have got to have a successful sales organization, right? And you've got to know how to do that. So I knew that would be an important part of my career as I moved on, and hence why even too, Dan, more recently, after I got out of school, I worked in a variety of marketing roles at Johnson & Johnson, and then here at Allergan on the Botox therapeutic team, but ultimately took the role I'm in right now so I could oversee the sales side of thing alongside the marketing as a general manager. And so that's what I'm doing right now.
So why Allergan? Again, every time someone says, and I don't know much about any of that,
Yeah.
I just know that they're like one of the biggest producers of Botox. Is that kind of what?
They are the only producers of Botox. So everybody knows Botox.
You can obviously know that this, unless it produces hair, I'm not going to know too much more about it than producing tighter skin. So, but honestly, on the Botox side, what you were focusing on wasn't specifically on that, was for other things, because you talked about migraines.
That's right.
Yeah.
Yeah, about I think it's still, I have to look at the numbers, but it's still about 60% of Botox use happens on the therapeutic side.
Wow.
So therapeutic is things like chronic migraine, things like overactive bladder, like cervical dystonia, like spasticity. So other indications that Botox works on, not the sexy stuff where it works on that too. But so that's what I was overseeing when I was working on the Botox therapeutic team, is the marketing, the U.S. marketing efforts for Botox. And, I'll share the fun story about how, I started out actually in eye care at Allergan 16 years ago. And at that point too, I was working on the glaucoma business, and we had a product that was used for glaucoma. So it lowered the pressure in the eye, but we noticed you had these nice eyelashes after you used it. And so the company went back and did the clinical trials to get approval for eyelash growth. And so they have a product called W.T.F used for that, right? So they had, it started out in eye care, and then it became a product used on the aesthetic side. Botox is actually a little bit similar as well. So Botox was originally, we acquired it for use with strabismus and blepharospasm were two of the indications that we originally had for Botox, which is basically wandering eye is strabismus. And we got it approved for those uses. And then people noticed that when they were getting it injected, actually Jean Carruthers, a physician up in Canada, noticed that patients were asking for it. If you got it in one eye, they're like, can you do it in the other eye? Because I noticed that it gets rid of the wrinkles over here. And so they did the trials to get it approved for wrinkles. And so ultimately, that's why we got the cosmetic indications for Botox. And then just one more piece of the story, they noticed that the people that were getting it for cosmetic injections, gosh, I'm not having these chronic migraines that I used to have. And so we went and did the trials to get it approved for chronic migraine and a lot of, the other indications.
I mean, what a great story, in the sense that it just kind of comes back to that you try something out and it ends up working in a different way. And when, totally. in my realm in sales a little bit, that if you try something one way and you meet somebody, you might not get something from that, but it goes a complete different direction, right? You want to use it for this, but it gets used for that. And when you were meeting someone for this, you end up meeting 4 more people for a different reason. So, I mean, it applies, to wrinkles as well as spasticity. I think I got that. Or is that?
I got right.
It's like the one I got right, but I appreciate that. So once you got the job at Allergan, how did you said, I'm going to stay in marketing and then I'm going to move up that way. Now you're back into kind of managing a sales team, correct?
Correct. Yep.
So in keeping in with your sales team on the accountability side, do they turn in sales sheets? Who do they call on? Who is your sales department usually call on?
Yeah, great question. So, so the glaucoma division, we have a surgical product. We have a sustained release implant that releases drug in the eye for glaucoma. And then we have glaucoma drops, right, that you put in your eye to lower pressure for glaucoma. And so we have 3 different sales forces that support those, but they're all calling on either ophthalmologists, comprehensive ophthalmologists, or glaucoma specialists or optometrists. So all different types of eye doctors is there. And you can imagine, similar to a lot of different realms, right? Those are their primary customers. Ultimately, the decision is going to be made around what's best for the patient. So the patient is the end customer, if you will. But a lot of our products, obviously, you can't get our products unless the physician believes it's the right thing. So we have close partnerships with the physician around the clinical aspects, and we have teams that support, the reimbursement side, as well as if they have some really specific questions on the clinical side. We have medical teams that support that. And so the sales force works really closely with a variety of different stakeholders to make sure that their customers are getting what they need, and they understand particularly what the need of that customer is and how they can, part with them to make it happen.
Right. So you brought me up. I wanted to come down some.
I did.
Number 1.
Oh.
I'm yelling. It's okay.
It might be me.
That's
I'm good
much better.
going.
No. All of a sudden, my voice went like in my ear, and my headset was like way too loud. But it's okay. I'm sorry. See, this is what we do here. We just learn as we go. It's kind of like we're just trying for
I like it.
skincare, and next thing you know, we're fixing eyelashes. So we just at the W.T.F. we just kind of make stuff up as we go. So now you're managing the sales team, and do you like that portion of it being you're still involved in sales? Or managing the team more than you like the marketing portion of it? Or which one do you think gives you the most satisfaction?
Yeah. Well, I mean, honestly, I feel really fortunate that I get to do both, right? Because I understand that sales skills, I always say if anybody has an opportunity early in their career to actually get formal sales training, because those are, I mean, whether you become a teacher, whether you become an entrepreneur, whether you become some kind of executive here, the skills that you learn in terms of being able to build relationships with people, that is really critical to success as a salesperson are ones that we all need, right? And so I love kind of leading the sales team, and this is across a lot of the team is a pretty tenured group that really know what they're doing, do have that level of accountability. And certainly though, COVID was a tough time for everybody, right? When you saw offices close and no office staff to support. And so it's been a crazy 2 years, right? But I do think that, that's a really fun part of my job, and figuring out how to keep people motivated and wanting to go out there every day and sometimes just be hitting the same message over and over again until it finally sinks in and gets through to some of our customers, I think is a key piece. But then I love on the marketing side, right, getting to make sure that obviously if I'm out in the field, if you can get me more data that helps support what we need to do, if you can get me product to add to my bag, all of those things are what we're trying to drive on the marketing side. Right.
So as you said, like Allergan has the only Botox is there. So in on the sales side of it, are they the only product in town, or are people buying because of the product, or is it still relationship driven where they still have to go to doctors and they still have to go to people and they still have to build the relationship, even though the product in some cases, does it sell itself, or is there still selling involved, or is there still something relationship building involved?
I think that, it's all of the above, right? So certainly you've got to have a clinical product that works, right? Doctors are only going to use your product if they believe that the patient will have the right outcomes. Right. But certainly there are products that are very similar. Right. And if they know you, Dan, and, they've been working with you, they trust that you're going to give them the right data, that you believe, that you are committed to, the best patient outcomes, that relationship, that partnership that you have means that they're going to choose your product over the next guys. And so that partnership, that relationship aspect is critical as well. And that's why I say, what's really fun about working in eye care at this company is we do have these long tenured reps that have been working with these physicians for years and years and have those relations. They understand the unmet need, what their patient base is like, and what the physician needs, and they're able to ensure that their narrative around what we offer is in conjunction or meets the needs of that particular physician and patient.
So how do you keep two-part question. How do you keep the sales staff accountable, and how do you keep yourself accountable to all the moving parts that are happening?
Yeah, it's a great question. And I want to say that I'm perfect at it, but I'm certainly not. I think though a lot of it is just regular check-ins and just that constant communication. And we do a lot of metrics reporting, right? And it's essentially how are we doing, and how are we doing versus last week, and how are we doing versus the week before, and what's the reason? And a lot of it is figuring out how to take those metrics and really understand the whys behind them, right? One of the biggest things, I go back to the COVID piece, but prior to COVID, it always used to be over year assessment. How are we growing versus last year? Right. And that you can't do that anymore, right? So last year was an anomaly, and the year before was an anomaly. One of my products we launched during COVID, right? So what is the art of the possible? I don't know yet. And so I think that's a big piece around viewing the metrics, but working with both my sales leaders, as well as even the sales reps, to understand the why behind those metrics and where we can push and what we can learn to adjust the plan as needed. Right.
Which is a huge thing. You just said the why. The why comes into so many different aspects, right? It comes into goal setting, comes into why you're going to do, why you want to keep accountable, why you want to succeed. So on yourself, because there's so many moving parts for you, do you use a calendar? Is it Outlook? Is it somewhere you keep yourself accountable to a day? What do you use?
Yeah. So I use Outlook. Certainly that has my day mapped out, but I think it's really important to work with an executive coach, right? To help you thinking about your future and what you want to achieve in your career, and making sure that doesn't take, a side, place on the side, right? Because, things get so busy that you literally, I think, sadly, the last time I went to go update my resume, the last time I updated was 5 years before, right? Because again, you just kind of move. And I think that just speaks to the having goals in mind, right? And then making sure that you're doing something from a professional and even personal side to move those forward, and not just always worried on the business is really important.
No, I asked you this before, and I'm going to ask it again. I firmly believe that people at one point in time know they're something different. They're better at something. I don't care if it's ping pong when they're 6 and they go, I'm really good at this. And they continually want to play ping pong, and they know that they're better than somebody else. I'd asked our last guest, like, when did you know, because he was an artist and a singer and songwriter, when did you know that this is something that you had within you? And the same thing for you. When did you know, that you were maybe smarter than everybody else in your class, or just in the sense of just that you knew that, biopharmaceutical is, or just in the pharmaceutical world, or just anything in sales? When did you feel that? When did you think that this is who I think I can be?
I think when you and I spoke, I think so. When it comes down to it, I'm a very intellectually curious person, right? Like, so you tell me about something and I might go look it up later and want to read about it if it's not something I know about. So one of the things that I think has helped me be successful is that I am so intellectually curious. So I want to keep learning about it and keep learning. And I think if I don't think I'm much smarter than most of the people. I can actually attest to the fact that I'm not smarter than most of the people that I work with. But what I do have that I think sets me apart is a work ethic, a sense of diligence, that I'm always willing to kind of outwork the next person. I'm passionate about what I do. I feel really lucky to be part of an industry where I do feel like at the end of the day, I'm hopefully helping a patient. So certainly that's helped, but I also really love leading teams. I love, again, helping people accomplish their goals. And so that keeps me passionate. And then the science side, I'm a huge science nerd. I love that stuff. And so that, again, I think that the fact that I love all those things so much has helped me kind of work a little bit harder, which has made me more successful.
Yeah, thank you for being modest. So when exactly did you decide you were going to go to Stanford?
You know what? I think I decided in second grade.
That's what I'm getting at. You're in second grade, and you said, you know what? I saw a football game. I think I'll go to Stanford and become a doctor. So there was something special that you had then, that was a drive that, it's because it's ingrained in you, and you're around a lot of people that may feel that same way, that have a different drive. But there's not many second graders that say, you know what? I'm going to go to Stanford, and then go to Stanford, and then go to medical school, and then get to, be a general manager in a Fortune 500 company. I'm going to change direction just because, luckily you're the first woman of influence that I've had on the podcast, which thank you for that. Is how it's got to be hard juggling. I know you have 3 kids. How do you handle the part where you're at a high level, you're at meetings all day? 2 questions would be, one is, how do you handle that?
Yeah.
Is there some sort of, even as a dad, I have guilt of where I am and what I'm doing.
Yeah. So I think certainly, right, like mommy guilt is real. So is daddy guilt, right? So I, fully acknowledge that I feel guilty all the time around not quite, if I didn't have kids and I was just working there, maybe I could be 100, like focused on this all the time. Likewise, if I was I feel like, I could be focused on that all the time. And this doesn't, having both, which I feel super fortunate that I get to have both, means that there's always this, God, should I be doing this, or could I be doing this? I'm the master of multitasking, and my husband says nobody is good at multitasking, just to be clear, but I think that I'm good at it. But what it really comes down to is, I think, really defining your priorities and recognizing that they may change. So for me, my me time is working out in the morning, or working out period, but the only time I can do it is if I wake up before the rest of the world. So I commit to doing that, and then getting home to make sure I can get the kids, to school and or ready and to school, and then heading into the office. And that morning routine is not something I'm willing to give up. So things like not starting meetings. My team knows, hey, unless it's an emergency, nothing before 8:30, right? And I'm able to kind of do that. And I encourage other folks to think about that with other team members that want to, have that first part of the day. I also think the leveraging a really strong support system is important. I think, Dan, you and I have talked about, I have a couple of other women that work with me that are, or used to work with me, that we still, we have a text chain going, and sometimes it's just misery loves company, let's be clear. But a lot of times, again, it's just great advice and them connecting with other people that might have other advice that can help you figure out how to balance and how to also see other opportunities. Maybe at this point in your life, you're looking for something that's going to afford you more quality of life. When I say quality of life, I mean more flexibility, right? And so therefore, there's somebody they may know that's hiring for this role. Or at this point, hey, my kids are now going to college. I have time to like put in more effort and really drive. And so then you have the opportunity to kind of get involved in that. The last thing I would say that's critical, I think it's critical, is outsourcing as much as possible. And so I think I order all my groceries online. I have a nanny that helps out at home, with the kids and the driving and all of that. I think as much as you can get away from having to do it yourself and just prioritizing the time piece. If it's an hour that I can have with my kids, then yes. If it's an hour like literally spent volunteering behind the closed doors, I'm not going to do it because they're not going to see me. I'm not going to get credit for that. Things like that, right? So that's kind of the way that I've, I wouldn't say I've been that's, but that's the way I've been able to manage it.
Yeah. And it's like you just said, it's hard. It's a juggle, right? You want to be successful and help as many other people, but then you have a family as well, which is, it's hard for them. I mean, men, women especially, and because there's not many women executives. And when you talk about multitasking, by the way, every man says you can't multitask because they can't. Every woman is really, really good at it.
There you go.
So, I mean, because guys, it's the ADD kicks in. It's like when you do two things at once, you're like, look, something shiny. What's that? A frog? I have no idea. Something bright. So yes, I think that every time, like you said, your husband says that's because every man says you can't, because every woman can. That's probably why, without a doubt. So on the executive level, women in the executive world, I know we had talked about a percentage. What do you think the percentage is of women at the higher level as executives in Fortune 500 companies or in general? What do you think?
Yeah. I should have looked up before to see. I know that we're really committed to that. Obviously, at Allergan, and AbbVie is the company that owns Allergan, and so we're really kind of committed to that. But as you would imagine, like a lot of other companies, you have a lot of more entry level or roles that offer a little bit more work-life balance, like flexibility. You have a lot more women in those roles, right? Sales are great roles where you're able to, again, kind of schedule your meetings with your docs around. Maybe you have to pick up somebody here or do that. And so those are roles where, again, I think we're probably more than 50% female in those roles. But as you move up, and again, requiring a lot more travel in roles as you move up, we have less females. And I think probably in the executive, we have probably 30%, and we want to move that, closer to the 50%.
Great. I couldn't agree more. So you're mentoring right now. You obviously had some great mentors, and you're mentoring people to come up. Are you helping them more on just, this is the direction to go, these are the ways to set goals, this is the next progression of your career, you're moving people as executives, or is it just an all-around basis of how to navigate in the business world?
Yeah, I think it's something too. Certainly, I always, wanted to be successful. What does successful mean? And I think that's the piece that I try to encourage somebody early in their career to think about what that looks like for them. So, and whether that's really what they want it to look like. And what I mean by that is, right, like if you've always wanted to have, family, then think about a career that's going to allow you to have a little bit more flexibility and do that, so that, so that you're ultimately wanting to work really hard, not resentful of your career or your family in that regard. I think the other piece is really understanding, what are you passionate about? I told you, I'm really passionate about marketing, about bringing new products to market, around the patient care and what that looks like. And I think I share with you, Dan, I love still getting behind the glass and patient research and being able to, really, understand kind of, again, what the end goal is with these patients and being able to feel that gratification. And so things like that. So I think understanding what you want about a career and what's going to make you happy are super important as I mentor folks. And then the second piece of that certainly is the connections, right? As we all know, connections, mentorships, knowing the right people, developing those people to kind of shepherd you through, to introduce you, to the right folks is really important. So that's another thing that I really encourage folks to do, is to meet people before you need them, right? So today I had lunch with a colleague and I said, you know what you should reach out to? They were in the same situation as you like 3 years ago. Go find out, and they'd be great. They're a really wonderful person to know. But this is something, again, that too, the next time this person needs something, it's great for them to know who to reach out to. But if you do it now before you need something, certainly you've created more of an easy conversation, right?
Right. So as you were talking, if you were to say to your second grade self that wanted to go to Stanford and achieve everything there, would it be, would you change anything from that? Or would you say, keep going, girl, you're going to make it. Don't give up yet. Or if you're in another way, would you give your daughter? That's a great question. So your daughter's not in second grade, but she's going in fourth. So she comes to you and says, I'm going to go to Stanford and I want to work really hard. I'm going to take that back. We'd all say, absolutely. But I mean, if it was somebody else's kid, what would you give? Would this be the same advice? Like, yeah, absolutely, go to it.
Yeah, I would. Certainly, I think, it's hard work, right? And it hasn't always been easy. But I do think, they always say, right, you can have it all, you just can't have it at the same time. Right. And I wouldn't give up either side or any aspect, really. I just recognize that sometimes I'm going to have more time to commit to this, less time to this. My friends know that I may not respond to a text for 3 days. It doesn't mean I don't love them. It just
no.
Things are crazy.
Do you think you missed out on anything? Do you think from the second grade that wanted to go to Stanford, so studied till 9 o'clock at night, in second grade? But do you think you missed out on anything? It's just a question. I don't know.
Yeah, it's a good question. And probably too, could my grades have been better in college? They could have, but I did go to, I almost sorority president, and I did my.
Of course you were. Why would you be sorority president? You were telling him how their skin's going to be way tighter. You just wait. I'm going to get a job, and you guys are going to look like you're 19 for the rest of your life. Don't worry about it. I got you, sister.
Exactly. But no, so I think too, I certainly had a lot of fun on the way. So I don't.
And I think that people think that. That's why I asked you that. People think that you miss so much. Like there's this, you have to pick one for the other. Like there's this compromise you have to give of, you can't have kids or you can't have a family if you're going to be a successful vice president or president of a corporation, because everything suffers. You just have to do it smart, and you have to do it right. And you have to, prepare. There's a preparation that goes with it, without a doubt.
Yeah. And I actually argue too, that the tribe that you have, that you need to be able to, that you need to have to be able to get everything done when you're juggling both, makes it like the connections that you have with people that that would help you out in a heartbeat, to pick up your kid or do that kind of thing. That means you're creating these certain bonds that you wouldn't have if you weren't dependent on a tribe to kind of support you in that.
Right. So what's your next goal? What's your next, you're the highest right now. You're not the highest, but you're pretty high up. Is there another goal? Is there another peak that you want? Is there another accomplishment that you want?
Yeah, certainly. I think, on a personal side, I just want my kids to get their summer homework done before we go back to school next week. Right. So that'll be my priority.
Tell me how to do it when you're done figuring it out. You're going to shoot it over to me. Jeez.
Exactly. And then I think, secondly, I think, I love right now what I'm doing, but I certainly, after GM, I want to continue to advance up through the organization and manage bigger teams and maybe even try different therapeutic areas. But I talked about my intellectual curiosity, right? And I think that, to continue to learn and be excited and passionate about what I do on a daily basis means that I won't be here forever in this role, right? It's going to be about advancing and meeting other folks and in new conditions, like I said, and so we'll see. Yeah,
man, that went by really quick. I could ask about 100 more questions. There's no doubt about it. I mean, the takeaway I got, Tara, just from being on, if you're talking about selling and you're talking motivating, you're talking about being a role model you won awards for, which I would love to go more into that. We could talk about that somewhere else, I'm sure, rather than sitting here on a Zoom call. But things I got is one for everybody here is specifically know the why of different things, why you would want to sell the products you have, why your product's better, why you want to succeed at the level that you want to succeed. And everybody says, know your why, but it's not just the why that pushes you to be successful, meaning like I'm doing this for my kids. It's the why of each different thing, the why of the product, the why of the people, the why of the relationships. That's the one thing I got from us today. The second thing is, having a drive early on and knowing and staying committed to that drive and specific to that drive. And then the other part is relationships. I think that everybody has to realize that, I'm blessed that I have a relationship with you and your family, that we're able to talk like this, that we're able to do different things. I think that you never know where relationships going to go, nor do you know what products or the things you are going to do are going to go, right? I mean, majority of the products you just said was for this. And then they realized, hey, you know what? It grows eyelashes. What a great thing. And Matisse is probably one of the biggest eyelash growers. I might need it pretty soon. Can you put it on my head? Does it work? Well, I have eyelashes on my forehead because that'll you got another client right now for live. Yeah, I will tell you this, that I feel smarter than I did 30 minutes ago. Not only because I had to read those big words earlier, just because listening to you about your business and everything you have. And it was so much fun. I really appreciate it. And everybody who's watching this, ladies and gentlemen, Tara Capalbo. The cheering was so loud for that there.
So good.
That was so good. The timing of that one was right. Maybe not the first one, we got that. Thanks again, Terry. Remember to subscribe to the podcast and share with your friends, especially everybody at Allergan. Everybody's going to watch this and love you more, and they'll subscribe, push the button from there, send all your friends, even if they're not your friends, send them this one. It's a great one. If it's a woman, send her this one too. You can get more of my videos and my books on manginelligroup.com. I'd love your feedback. You can email me at dan@manginelligroup.com. Let's do this again real soon, Tara. Can we do that? So everybody out there, go have fun and make dreams come true. Take the pain out of my waist. Little wishes far from